Hi, parents of Cafecito. So welcome to our Cafecito. Today we have some wonderful information about just prevention in general, health, your health, services that you might qualify for. So we want to give you that information. So we're also going to be available on Wednesday for comments, questions, just to follow up. And we're going to have the presentation for this talk and more resources at our Cafecito site that we have on the GB page. Mr. Ramirez.
Hey, dear parents, thank you so much for taking the time to watch this video. We are trying to bring you information that is very pertinent, that is very important, especially during this time where many of us are just staying home and we don't have access to a lot of resources. So we want to bring that to you into the comfort of your own home so you can watch them when you have the time. And please remember, if you have any questions, we are going to be here live Wednesday at 2 p.m. And then after that, you can always reach us here at school. Not only with questions about what you're going to see today, but about anything else that is important to you. We want to be able to find resources for you to help you. So if you have something that you really would like to know a little bit more about, let us do the homework, because chances are Ms. Itzel already knows a lot about that. So without further ado, let's welcome Ms. Itzel. Would you like to introduce our wonderful presenter for today?
So we have Ms. Maria Lopez with us this morning. So she's going to be talking to you guys about the Chdp program. She's going to be giving you information about that, also medical services and other services that might be of good use to you. So Ms. Maria, please take it away.
Okay, good morning, parents. My name is Maria Lopez. I'm with the Monterey County Health Department. I represent the Child Health Disability Prevention Program, better known in our community as the Chdp program. We are located at 1270 Natividad Road, Salinas, 93906. Our phone number, if you ever have any questions in regards to our program or after this presentation, our direct number to our program is 831-755-4960. Thank you. So you might be asking yourself, what is Chdp? Well, Chdp is a state program, and it's a California state program that provides children comprehensive and prevention services. By comprehensive and prevention services, it is physical exams, immunizations, and lab work. And this is the program that offers those services. Chdp stands for the Child Health Disability Prevention Program. Now, you probably are asking yourself, who qualifies for this program? Well, let me just share with you that if you have a child who is under the age of 21 and is receiving full scope Medicare, and at the same time is connected with the managed care program, Central California Alliance for Health, this program is offered to those children until the age of 21. Now, if you happen to have a child who has no health insurance or Medicare, but is in need of physicals, immunizations, or lab work, then this program is offered to kids under the age of 19. And the requirements for children who do not have health insurance, the requirements to use this program are the following. The child has to be under the age of 19. The child at that moment, has no health insurance, and the child's parents' income is moderate to low. So then this program can be used for those kids for the prevention services, which are the physicals, immunizations, and the lab work, okay? So if the child has Medicare up to the age of 21, with Medicare, child has all the services that it needs. But again, if there's no insurance or Medicare, the child lost the Medicare, the family just arrived, the family lost their insurance, but the child under 19 needs a physical, immunizations, or both things. Again, keep in mind, Chdp can be used for these services. Chdp is a program, ladies and gentlemen. It's not an insurance like the Medicare, okay? Where do you apply? We have a list of providers, different providers in Salinas that offer this program. Some of the following providers are Clínicas de Salud, Santa Lucia, Natividad Medical Center, LSL Health Center, Valle Verde. We have a few pediatrics that are located on Romy Lane, that offer this program also, okay? So you apply for this program at a provider's office, one of the ones that I mentioned, for that physical immunization that the child may need at
Let
that
me just
moment.
add real
And they
quick
have.
that we are gonna be adding
Sure.
that list. You know, with the Cafecito, we're gonna be providing the list of providers so you have it available as well.
Yes, definitely. I'm going to be providing that list of providers, dentists, and optometrists to Mrs. Sale. And if you have any questions, you want to find out who are the providers, you're more than welcome to ask her, okay? We really encourage for school staff to keep that information, and they could share the providers' names to parents if they need to see a provider, okay? One of the things we really encourage our parents, I know that when we have a lot of families that are recently arrived and they're trying to enroll their children in school, I know the number one thing are immunizations, which are very critical and very important. But we also encourage our parents that, by all means, go ahead and get the immunization that the child may need. And if the child doesn't have health insurance, they're under the age of 19, you could use the program Chdp. But eventually, after the child has had the immunizations that they need to enroll in school, we really encourage our families to make an appointment for a physical exam. That is also very critical. Physical exams just kind of let us know where the growth, the development of the child is at that moment. They do so many tests, the height, the weight, the blood pressure, cholesterol check, urine check, all those things are very, very critical. Central California Alliance and our program, CHTP, recommends a physical a year. That's very critical. Many things happen within a year, so you need to be on top of that for your child. So again, once a year, physical exams. Immunizations, well, of course, you know, there's certain ones that come at certain times. Right now, we're hearing about the flu vaccine. That's very critical, especially right now in the winter, and also because of what's going on with this COVID-19. They're really recommending that everybody beginning at 6 months to have that flu vaccine. But also the physical exams are very critical, ladies and gentlemen, because again, this is what lets us know how our child is doing, and I think that's very critical at any age to have those physical exams. So our CHTP, we describe it as from head to toes, starting at the head, finishing at the toes. And you know, there's many exams that happen, the dental, the nutrition, the development, the vision exam, the hearing exam. All those are very critical, and it is important that children have it at least once a year.
And I think, Ms. Lopez, and I think the key is prevention, right? We want to prevent chronic illness, and we want to make sure that we're getting our checkups. And if you don't have insurance for whatever reason, or you're kind of stuck and don't know where to get it done, here's a service for you, a program that might help you out, because you know prevention is key right now.
Yeah.
Especially with everything going on, prevention is such
One of the things that parents that we're encouraging right now is to continue taking your children for your vaccines and physicals. I know in the beginning of this pandemic back in March, there was many things, services came to a halt. Well, now once again in the last few months, clinics are starting to see clients, they're starting to see children. And keep in mind, in speaking with clinics, providers, they are taking every precaution to make sure the children and the adults are safe when they're in their clinics. But I think it's important that we start going back again for those physicals, especially for us adults. You know, that's critical. We need to continue those services, going back to the doctor again. And again, in speaking with providers, I'm aware that they are taking every precaution possible. So we need to start those physicals for children, those shots for kids, and also our health care for us adults. We need to start up again and try to obtain those services for our health well-being. Okay, that's very, very critical. And as I said before, we have many providers, many clinics that offer our program, and I will provide that list to itself if you guys are interested in finding out who is offering those programs. So again, just to reiterate, CHDP, Child Health Disability Prevention Program, okay? This program is offered to two populations. For children under 21 who have full scope Medicare and who the health plan is Central California Alliance for Health. The other population is for children under 19 who have no health insurance, Medicare, or money. And the requirements for parents to use this program for prevention services are age, under the age of 19, income, moderate to low, insurance that the child has no health insurance to use at that moment. Then the parents can use this program, okay? Now, moving on from
Ms. Lopez,
CHDP.
in
Sure,
doing my
go ahead, Mia.
research, in doing my research, I noted that this program is offered throughout the state, and not only that, but it's under different name in other states as well. So there's something similar. So we know families migrate, we know people relocate. So please ask for those supports, ask for those programs. If we don't ask, we don't get the services. I cannot say that enough. If we don't ask, we don't get the services. So it's crucial that we ask, and it's crucial that we get the services for our families.
Yeah, please keep this in mind, parents, and it's health. This program is in the state of California. This program is in all 58 health department counties. This program doesn't change name. Every health department at every county, 58 counties in California, this program is under the umbrella of the CHDP program. So if you move to Sacramento, and if you go to the health department and you want to get information on our program CHDP, that's the way you would ask. If you move to Fresno and you go to the health department, you look for information under CHDP. If you go to Imperial County at their health department, if you want information on CHDP, you ask. That doesn't change in the state of California, ladies and gentlemen. Those four letters stay the same. Child Health Disability Prevention Program, CHDP. So you just go directly to your health department in whichever county you may be, ask for information for CHDP, and they'll give you the information and doctors that offer this program in that county. Okay, so it doesn't change name. The four letters stay the same at every health department in the state of California in the 58 counties. Okay, just clarification. Okay, this is a program. Okay, this is a program. It's not an insurance. This is a program. And like any program, this program only offers the prevention, the comprehensive prevention services, physical, immunizations, and lab work. Those are the services this program offers first and foremost. Okay? Now, let me move on a little bit about CHDP and what we call the temporary Medicare gateway. When children under 19 use this program because they have no insurance or medical or the money to pay for it, these kids also qualify for what we call a CHDP temporary Medicare. This temporary Medicare is good for 30 to 60 days. This temporary Medicare can be used for dental, hospital, vision, doctor, specialty, for many services. However, it's only limited, 30 to 60 days. So when I'm speaking to the parent, because the child under 19 uses this program, I will let them know that while they use the program for the physicals immunizations, they also qualify for the temporary Medicare. These are the services the child could use them for, but it's only a limited time. And I'm going to encourage the families to apply for the regular Medicare if they can. And I will provide the resource where they could call and try to apply for Medicare, full scope Medicare. Okay, because that's very
and you know, Ms. Lopez, and there's a lot of people that don't even know they qualify, right? So that going back to the point, you need to ask, you need to make sure you advocate for yourself, because I know a lot of people qualify and they're scared or they don't know who to go to. So me and Mr. Ramirez are gonna make sure that we put those resources under the Cafecito to make sure that you know where to go and just you have those resources available, because a lot of people qualify and they just don't take advantage of it.
And they do, and it's so true, Itzel, you know. And like I said, I think one of the things that I've learned is that, especially I've recently families that have come, you know, a lot of them are with political asylum. A lot of them just established residents. They can apply for it. So there's many reasons.
Mm-hmm.
What I do, I just offer the resource to the parent. They know, you know, whether they can or cannot. Many times they'll feel comfortable and they share, well, if this is my situation, do you think I will qualify? And like I always tell my parents, you know, I'm not the expert on Medicare. So let me give you the number where you could talk to someone in Medicare and they are the experts. I'm not. I know very basic, the top of the Medicare program, but there's a lot to Medicare. So I said, you know, I'm going to give you the number and please direct yourself to the experts. And you put your questions to them and they will let you know whether you can or cannot because of your situation. As I tell parents, just try and ask. Doesn't take nothing away from you. Yeah, that's it, you know, that's all you could do. Nothing else, you know. So again, the CHTP temporary Medicare, okay? So please, again, you know, if there's something that you want to apply for Medicare for your children, I will provide that number for Itzel. The resources here on this PowerPoint that you're viewing as you're hearing our conversation. So please feel free to call those numbers and get more information. Many of our families, it's been my experience working with this community, is that we have families that have, you know, jobs which provide private insurance. We have families that may have Cover California. It's a very small number of Cover California. But I have to say that the families that I worked with through the years, I would say about 60-70% of our families can qualify for Medicare. They can. It's just that not knowing, maybe not wanting,
the lack of information.
maybe they're afraid. Yeah, maybe they're afraid. But like I always tell them, you need to ask. And of course, if they tell that you cannot, okay, that's fine. But at least you asked and you found out whether you can or
you
cannot.
know, and that's why me and Mr. Ramirez put these cafecitos together, because we understand that sometimes we don't know where to go, we don't know where to start. So we know school are a resource where maybe you get started. So that's why me and Mr. Ramirez try to bring these resources to make sure that we help with that lack of information, because sometimes we really do feel stuck and we don't know where to go. It's a reality.
Yeah, and that's true. It's so true. It's, you know, and one of the things, like I said, we encourage our families to apply for Medicare. And once they have full scope Medicare, then their managed care program is Central California Alliance for Health, which is a great managed care in our county. So we really encourage our families to try to apply for Medicare if they can, okay? Because again, many reasons sometimes, and I heard them all, they cannot apply. Not that they don't want to, is that they cannot at this moment, you know? But keeping in mind, again, with this program, it said, this program, CHTP, children could have a physical exam once a year. They could have their immunizations whenever they need immunizations. And every time they use our program, they will qualify for a temporary Medicare, 30 to 60 days. And I say this itself because many of our families, especially our Hispanic families, cannot apply for Medicare because some of them just established residents, and for 5 years, they cannot apply for anything, okay? And other families are here seeking political asylum. Those families sometimes cannot apply for Medicare. They can. However, I encourage families to keep in mind that this program, CHTP, can be used once a year for physicals, immunizations, and at the same time, they will qualify for the temporary Medicare. And while they have the temporary Medicare, use it, dental, vision, doctor, or use it within those 36 days because the temporary Medicare will end. That's critical. And that's one thing that hopefully you share with the Spanish-speaking parents. Sometimes, you know, I miss some things, but I know how critical this is. That's so
Yeah.
critical. I realized it. Okay.
Yeah,
And,
no, we can't thank you.
Yeah. Yeah. And moving on, my last topic is the SB 75. This is
Yeah.
a law that was implemented here in California in 2016. This law allows all children under the age of 19, undocumented children, the possibility that parents could apply for the regular full scope Medicare. Okay, or these kids under 19 who were not here legally, the only services they qualified was CHTP. However, 4 years ago, SB 75 was implemented in California, and now it makes it possible that parents can apply for the regular Medicare for their kids under 19 who are here undocumented. They still have to meet the Medicare requirements, but now parents can apply for these kids so they could have full scope Medicare, and their health plan will be the Alliance for California. Okay.
Well, thank
And
you
I
so
think
much,
that's
Ms. Lopez. All those resources for us are so crucial. Mr. Ramirez?
No,
Mr.
absolutely.
Ramirez.
We are so grateful again, Ms. Lopez, for taking the time to really enlighten us. I mean, I know that I am new to this county myself, and I don't know a lot of these resources. And I know, like Ms. Itzel mentioned, and you mentioned, a lot of our families are constantly on the move, and they're moving from county to county. And there's probably, I would say that there's even people that have been here for a little while that don't know about these programs. So this is extremely helpful, and we hope that parents really take the time to listen. And like I said, this coming Wednesday at 2 o'clock, we're going to have a Q&A, live Q&A, if there's anything else that parents would like to know about the subject. So thanks again, Ms. Maria. Really appreciate it.
And those resources.
Mr. Ramirez, you're brand new to this county. There's a little, melancholic. And then I feel a little bit like that too, because I'm getting ready to retire. But however, I'm well aware that there's still so much need, and we have so many families coming in all the time. But I take heart. I may be retiring from my job, but I will always be an advocate for the community. That's always been my passion. So I hear where you're coming from, because I feel that just different situations, right? I feel where you're coming from, but the possibilities are endless for you to learn all those things. And for me, well, like I said, I will continue being part of this community, maybe not in the same, position that I find myself right now, working with the county. However, I will always be an advocate for Monterey County families. So best of luck.
And we thank you. We thank you for working with the Santa Rita district, because I know you've been doing presentations for us for the past, I want to say, 2 years. So we can't thank you enough. We know these resources help our community so much. So me and Mr. Ramirez are gonna make sure that those resources are there, easy to access, because we know when you have an emergency and you need those resources, you can't really think, right? You feel stuck, and it's hard to think of what's available. So we want to make sure that those are available when, hopefully you don't have that situation, fingers crossed you don't have a situation like that. But if it were to come up, we want to make sure that those resources are there. So like Mr. Ramirez said, we are going to be available on Wednesday. Check out the Cafecito link on the GB page, because we're gonna be adding the different resources that we talked about today, in case you forget. And we look forward to working with you on Wednesday and answering all your questions. So thank you so much, parents. We'll see you Wednesday.
All right. Thank you very much for the invite, Ben.
Thank
you. Okay, you guys
Everybody.
take care.
Take care.